The real causes of high blood pressure, and how to prevent it. High blood pressure, or hypertension, is one of the leading causes of death worldwide, often without obvious symptoms. It puts immense strain on your heart and blood vessels, increasing the risk of heart attacks, strokes, and kidney disease. It's crucial to be aware of everyday habits that might be unknowingly raising your blood pressure. While some factors like age and genetics are beyond control, many lifestyle choices, such as diet, exercise, and stress management, play a significant role. In this video, we'll explore the main causes of high blood pressure and provide natural strategies to help you lower and manage it, ensuring better heart health and overall well-being. 12 real causes of high blood pressure. 1. Genetics. If your parents have high blood pressure, you're more likely to develop it too. High blood pressure often runs in families, which could be due to similar habits like diet and exercise. However, there's also a genetic factor involved. Studies suggest that genetics may contribute to 30% to 60% of high blood pressure cases. Certain genetic conditions can cause high blood pressure, such as hyperaldosteronism, Gordon syndrome, Liddle syndrome. Other gene variations might also increase the risk of high blood pressure. For example, a 2019 study found that a change in the ARMC5 gene could explain why high blood pressure is more common in Black and African American communities. While we know that genetics can play a role in high blood pressure, more research is needed to fully understand how much having a family history of the condition actually increases your risk. 2. Age. As you get older, high blood pressure becomes more common. According to the CDC, from 2017 to 2018, hypertension was more frequent among older adults. The following are the statistics for different age groups: 18 to 39 years, 22.4%; 40 to 59 years, 54.5%; 60 plus years, 74.5%; all adults, 45.4%. The National Institute on Aging, NIA, explains that the risk of high blood pressure increases with age because your blood vessels become stiffer as you get older, which can raise blood pressure. This can happen even if you maintain healthy habits. The NIA advises older adults to follow the same healthy practices as younger people, such as quitting smoking, if you smoke, reducing alcohol intake, if you drink, staying active, and eating a balanced diet. They also recommend taking any prescribed medications and visiting your doctor regularly to manage your blood pressure. 3. Lack of sleep. Most adults need at least 7 hours of sleep each night for good health, according to the CDC. However, many people don't get enough sleep, and this can affect your health, especially if you have high blood pressure. Normally, when you sleep, your blood pressure drops, giving your heart and blood vessels a rest. But if you struggle with insomnia or don't get enough sleep regularly, your body doesn't get this important break, which can raise your blood pressure. To make sure you're getting enough sleep, try practicing good sleep habits. The CDC suggests the following tips: go to bed and wake up at the same time every day, even on weekends. Get plenty of natural light during the day, especially in the morning. Stay active during the day, but avoid exercising too close to bedtime. Avoid bright artificial light in the evening. Consider using a blue light filter on screens. Don't eat or drink too close to bedtime, and avoid alcohol and heavy, sugary foods. Make your bedroom cool, dark, and quiet to promote better sleep. 4. Smoking. Smoking is a leading cause of preventable death, linked to serious conditions like heart attack, stroke, lung disease, and various cancers. While the exact connection between smoking and high blood pressure isn't fully understood, it's clear that smoking can cause temporary increases in blood pressure. It also contributes to atherosclerosis, which is the hardening of the arteries. Stiffer arteries make it harder for blood to flow, leading to higher blood pressure. If you smoke, the American Heart Association, AHA, recommends quitting as soon as possible. Stopping smoking can improve your health in many ways, and some benefits begin just 20 minutes after you quit. 5. Health conditions. Most cases of high blood pressure are primary, meaning they develop for many different reasons. However, some underlying health conditions can cause a specific type of high blood pressure, known as secondary hypertension. By treating these conditions, it's often possible to reduce or reverse the high blood pressure. Conditions that can contribute to high blood pressure include being overweight or obese, diabetes, chronic kidney disease, pregnancy, certain heart irregularities. Addressing these health issues can help control blood pressure and improve overall health. 6. Being overweight or obese. Obesity is a major health condition that can contribute to high blood pressure, and it deserves special attention. A 2020 study found that obesity was responsible for 65% to 78% of cases of primary hypertension. Being overweight or obese can lead to high blood pressure and can make it worse if you already have it. Carrying extra fat changes how your body functions, including affecting your kidneys and how they process fluids. It can also affect how your body uses insulin, leading to insulin resistance and type 2 diabetes, which are both risk factors for high blood pressure. If you're overweight or obese, losing just 2% to 3% of your body weight could reduce your risk of heart disease and high blood pressure. However, healthcare professionals often recommend aiming for a 5% to 10% weight loss, usually with a combination of healthy eating, exercise, and other lifestyle changes. 7. Lack of exercise. Not getting enough physical activity can harm your health in many ways. It can make mental health issues like anxiety and depression worse, and it can also lead to weight gain. Exercise helps you maintain a healthy weight or lose weight if needed, which can improve your blood pressure. It also boosts your energy and overall well-being. The American Heart Association, AHA, recommends the following guidelines from the Department of Health and Human Services. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous exercise each week. Do muscle strengthening exercises at least 2 days a week. Spend less time sitting. Work up to 300 minutes, 5 hours, of activity per week. Gradually increase the amount and intensity of exercise as you go. By following these recommendations, you can improve your blood pressure and overall health. 8. Salt intake. Eating less salt can help lower your blood pressure. Salt contains sodium, which is also found in many packaged and processed foods to enhance flavor. A 2019 study showed that cutting back on sodium could lower blood pressure, even for people who already have high blood pressure. In the United States, most people eat too much salt. The average adult consumes about 3,400 milligrams, mg, of sodium per day, which is 48% more than the recommended amount. The Food and Drug Administration, FDA, advises a limit of 2,300 milligrams per day, which is about 1 teaspoon of salt. The World Health Organization, WHO, suggests an even lower limit of 2,000 milligrams per day. The American Heart Association, AHA, recommends no more than 1,500 milligrams daily, especially for people with high blood pressure. Cutting back on sodium is a simple way to help control blood pressure and improve health. 9. Alcohol. Drinking too much alcohol can harm your health, especially your heart and blood vessels. It can contribute to or make high blood pressure worse, and it also increases your risk of diabetes and certain cancers. The American Heart Association, AHA, suggests that men should limit themselves to 2 drinks per day, while women should have no more than 1. Here's what counts as 1 drink: 12 ounces of beer, 4 ounces of wine, 1.5 ounces of 80 proof spirits, 1 ounce of 100 proof spirits. Even drinking in moderation can still have negative effects. A 2019 study with over 17,000 people found that moderate alcohol consumption, 7 to 13 drinks per week, can significantly raise the risk of high blood pressure. Another study from 2020 also linked moderate drinking to high blood pressure, especially in people with type 2 diabetes. 10. Caffeine. About 90% of people in the United States consume some form of caffeine daily. The American Heart Association, AHA, says caffeine isn't harmful to blood pressure unless you have too much. In fact, they also note that drinking coffee may be linked to a lower risk of certain health issues, like cancer and heart disease. For most people with high blood pressure, drinking 3 to 4 cups of coffee a day is generally safe, according to studies from 2017 and 2021. However, drinking more than that can cause anxiety, heart palpitations, or other problems. The FDA suggests a limit of 400 milligrams of caffeine per day for healthy adults. To give you an idea, an 8-ounce cup of coffee has 80 to 100 milligrams of caffeine. An 8-ounce cup of tea contains 30 to 50 milligrams. An 8-ounce energy drink has 40 to 250 milligrams. A 12-ounce can of soda has 30 to 40 milligrams. If you're concerned about your caffeine intake, it's a good idea to talk to your doctor. Caffeine can raise blood pressure temporarily, so if you're checking your blood pressure, wait 30 minutes after drinking caffeine for a more accurate reading, according to a 2022 study. 11. Pregnancy. High blood pressure that develops during pregnancy is called gestational hypertension. If you have it, it's important to manage it to keep both you and your baby safe. Doctors typically define it as having a blood pressure of 140/90 of a millimeter Hg or higher. There are several factors that can increase the risk of high blood pressure during pregnancy, including being overweight or obese, not getting enough exercise, smoking, drinking alcohol, having a first pregnancy, a family history of pregnancy-related high blood pressure, carrying more than one baby, being 35 or older, using fertility treatments like in vitro fertilization, IVF, having diabetes or autoimmune diseases. You can reduce your risk of high blood pressure during pregnancy by managing lifestyle factors like weight, smoking, and alcohol use. It's important to talk to your healthcare provider if you're concerned about your blood pressure during pregnancy. 12. Medications. Some medications can cause your blood pressure to rise. A 2021 study found that 18.5% of people with high blood pressure were taking medications that could make their blood pressure even higher. Medications that might increase blood pressure include steroids, non-steroidal anti-inflammatory drugs, NSAIDs, decongestants, antipsychotic drugs, birth control pills. If you have high blood pressure, it's important to talk to your doctor about all the medications you're taking, including any over-the-counter, OTC, drugs, to make sure they're not affecting your blood pressure. How to prevent high blood pressure. The American Heart Association, AHA, offers several ways to help prevent high blood pressure, which are also good for managing it. Get regular exercise. Don't smoke, or quit if you do. Drink alcohol in moderation, or avoid it altogether. Keep a healthy weight. Eat a balanced diet that's low in salt. Manage stress. Work closely with your healthcare provider. By making these healthy choices, you can lower your risk of developing high blood pressure and improve your overall health. The bottom line. There are many factors that can increase your chances of getting high blood pressure. Some of these you can control, like your exercise habits, diet, and whether you smoke or drink alcohol. Others, like your age and family history, are beyond your control. If you already have high blood pressure, you're not alone. Almost half of adults have it. You can lower your blood pressure by making healthy changes in your habits and working with your doctor if medication is needed. If you don't have high blood pressure, it's still important to check your blood pressure regularly, especially if high blood pressure runs in your family. Many people don't realize they have it, even those who live healthy lifestyles. You can reduce your risk by adopting healthy habits now. Thanks for watching. If you found this information helpful, please subscribe to our channel for more tips and updates.